Welcome to Module 7. The focus of this module is on expressive language. Over the past two modules, you've learned about receptive language, the understanding of language, or listening auditory comprehension of language. So in this module, in Module 9, we're going to be focusing on expressive language, so that oral, verbal, expressive ability of language. A communication disorder is characterized by a delay in spoken language when we're looking at the area of expressive language disorder. So the delay is in speaking and verbal oral production of language. A specific expressive language disorder refers to a delay in talking as compared to the receptive language and cognitive skills. A non-specific expressive language disorder refers to a substantial delay in talking that is secondary to some other diagnosis, such as autism spectrum disorders or some nonverbal disorders, maybe some cognitive delays where an individual is vocalizing little or not at all, but it's secondary to that primary diagnosis. Echolalia is when we hear a child who is verbal, but they just imitate what they hear either immediately or delayed. So you might say something and then they repeat it after you right away. Or they see a show or hear something and then repeat it later in a delayed format, but it's exactly what was said to them. Expressive disorders in the area of syntax mean that somebody's having difficulty with the rules governing language. So this isn't the first time you've heard that term syntax. So an example could be somebody who's having difficulty using negatives in their speech and they do not do it properly, such as me no go or I not going. Expressive disorders in the area of semantics involve that vocabulary and labeling. So the student might just say that thing instead of the actual word, or try and do other strategies to talk around the word that they're trying to find. They have difficulty categorizing, so they don't know how items are the same, how they're different. They can't tell you why they go together. And they have difficulty with non-literal language, so with idioms and figurative language like proverbs and metaphors. So they can't tell you what those different types of figurative language mean because they take everything in a literal sense. An expressive language disorder that involves morphology relates to the structure of words. So if you remember back that a morpheme is the smallest meaningful unit of language, the word cats has two morphemes. Morpheme 1 is cat, meaning the animal. Morpheme 2 is the S, or the plural, indicating more than one cat. Expressive disorders involving pragmatics is that use of language for the purpose of social communication, and we'll talk more about that in future modules. Difficulties here might be seen in greetings, farewells, turn-taking, starting and ending a conversation, using eye contact correctly, requesting or commenting. So using language to satisfy their needs in a social type situation. MLU, you've also heard this term before, refers to the mean length of utterance. So how long each phrase or sentence is that a person uses. So our individuals with expressive language disorder typically have a shorter MLU. So we obtain that MLU by looking at a sample of their utterances and how much how many words are in those sentences. We count the words and we divide that by the number of utterances so we can see what is their average mean length of utterance. Here's an example of an MLU. So C is child, A is adult. Adult says, "What is that?" Child says, "Truck." Adult, "Where is your truck going?" Store. "What's at the store?" Candy and toys and Spider-Man. Wow. So if we were to calculate this, the MLU for this child would be 7 words total divided by 3 utterances, and their MLU would calculate to 2.33. When we do a calculation for MLU, we don't typically look at this short of a language sample. We usually do a much longer 50 utterance or 100 utterance type sample to calculate that MLU. So question words are often an area that we see our students and individuals struggle with when they have an expressive language disorder. So they have trouble answering those question words and understanding what, where, who, why, and when and how, what those questions refer to. So then they can't always answer those questions. So this is the developmental order that we typically get these questions in. So we usually teach what questions first, then go to where, who, why, when. Vocabulary is also something that's typically impacted in an expressive language disorder. So we might look at different types of actions or routines to encourage more vocabulary and language development. So doing games like peekaboo, trying to encourage vocalization. So any sound a young infant or child makes, trying to tickle them or sing or hum and encourage other sounds and then words as we develop that vocabulary. Children repeat words that they've heard. They use these words to communicate about their social and physical events in their life. So modeling vocabulary is so important with our young children. Children begin by using single words, and those single words can mean a whole sentence, right? So wash can mean that they wash their hands. It can mean the dog is getting washed. It could mean I hear the washing machine. As they get more language, then they can put words together to then clarify which of these types of things they want wash to mean in that situation. So this is just a very small snippet of expressive language. You're going to learn more in the reading information and what you review this week. And just remember, as an assistant, you're always going to be following that direction of your SLP. They're going to be developing the treatment plan, writing the goals, helping you understand the steps to work on those goals. And then you're going to help create activities to go with those goals, decide what materials and activities you might need, and then make some decisions on how you would implement those. And of course, discuss everything with your SLP. That's what they're there for. As you get more experience, you can do more of this independently, but you want to make sure that you get a good foundation of what do different goals mean? What are the steps for me to target within those goals? And then how do I do that with different ages of individuals?